Every community in the country has people that are currently in a mental health crisis. Too often, these people are turning to using hospitals, law enforcement, substance use, and even suicide to manage the overwhelming situations. They can also be wary of getting support in a crisis if it means overnight care in a facility. But there is a model for how crisis can and is being delivered effectively in a least restrictive setting. Crisis retreat facilities are a starting point for those who have never accessed services before or need additional support beyond their current services in time of a crisis. Three key elements of a retreat model make it different from typical treatment facilities. The physical layout is an open retreat, staffing significantly features lived experience, and there is a substantial impact on the community. In the mid-1990s, Recovery Innovations began hiring large numbers of peer supports and launched the first crisis living room model just outside Phoenix, Arizona. Crisis retreat facilities are supporting and seeing people 24/7 and don't turn anyone away. They are available to anyone seeking assistance for a crisis situation. Retreat facilities are multidisciplinary as they use peers, therapists, nurses, doctors, and NPs to make it all work. They work using a team approach with every guest, so decisions are made together. At this Phoenix retreat facility, law enforcement is responsible for more than 80% of the referrals. Over the past 4 years, more than 13,000 individuals have admitted to this crisis urgent care center by police. But none of those had to go to the emergency room to wait. Despite a very high acuity, individuals are greeted by a caring peer support orienting the person in distress to care. They are referred to as guests and not patients or consumers. In 2010, Optum Health replicated this model near Tacoma in the view of Mount Rainier. This retreat provides warm compassion and high engagement when a consumer comes in. The walls are painted and decorated to encourage positivity and recovery through the use of murals and guest artwork. Here, the welcoming setting is not exclusively indoors. The outdoor patio overlooks a reed pond where guests can connect with others. Funders start these programs to decrease costs, reduce incarcerations, and improve recovery for those they serve. But change can be hard. In Delaware, a lawsuit from the Department of Justice provided the Department of Substance Abuse and Mental Health the opportunity to implement this retreat model in 2016. About 1 in 4 staff are certified peers. Peers are employees with lived experience and provide valuable social and emotional support during their journey. Peers are the first and last person guests see during their stay. They are the overwhelming proof and a reminder that recovery works, spreading the message of resilience and hope to all guests that are struggling. In 2016, the team at Atrium Health opened the Mindy Ellen Levine Behavioral Health Center just outside Charlotte, North Carolina. This crisis facility features peer staff, trauma-informed care, and a setting that is unparalleled. They have committed to creating positive, nurturing environments, minimizing the possibility of traumatizing the person in distress. This includes providing services in an inclusive and person-centered manner, using non-coercive support strategies. Their space resembles more of a home than a state hospital, communicating that a person with mental health or addiction crisis matters. The retreat model says we care before even entering the building. Even in the secure Sally port for police drop-offs, the design team thought about trauma-informed care and safety at every step. In 2017, Riverside County in Southern California took the retreat model to its highest level yet, inside a campus of care. Their prior facility, which opened in 2015, was temporary, but the change was dramatic nonetheless. Inside and out, this retreat welcomes and heals. This space was designed for recovery. The furniture is arranged to promote connection. The layout provides the ability to receive private and individualized support. The staff is able to connect with persons in distress and stay with them until they feel safe again. When these retreat settings are staffed with individuals who care, who actively engage and collaborate, distress is calmed, crises are stabilized, recovery plans are activated. The retreat model strives to provide services in a safe, supportive, recovery-oriented environment. This isn't the future. The retreat model is today.